What we're going to do now is to, with the patient, we're going to work into the biceps tendon, the long head of the biceps. Now this is a really crucial part of the technique, and it's important that you get this right, because especially in the early phases, phase 1 and 2, it can be extremely tender. So first of all, again, just introducing your hands here, I'm just going to work a little bit of Nivea into this, or a little bit of cream into it. Again, thinking about your hand hold, sometimes a patient can't internally rotate or externally rotate too hard. So if we leave the hand here, and what we're going to do is we're going to work up into the biceps tendon long head. And what you'll feel is nodules starting around about here, just as the sort of muscle becomes tendon. And I want you to pause on those nodules and get you to think about your breathing. And again, when we've released that one, we can come on to another. And as we approach the transverse ligament of the long head of the biceps, there's a really tender part that comes up here. And again, it's just important that you pause long enough to allow that to release. Again, we're looking for a fair amount of pressure, but a kind of mutual pressure where it doesn't feel too uncomfortable for the patient, and it feels quite comfortable for you to rest. Notice I'm not pushing, I'm sort of leaning, just resting on the point, and if I want to push, just sort of lean a little bit heavier. Because you're doing really well. Breathe it through. Terrific. Okay.